Well, just because we've been wearing face masks doesn't mean that we are immune to skin cancer. And joining us now are Drs. Kim Schlesinger. She is a medical oncologist and medical director of the Cancer Institute at St. Joseph Medical Center, and dermatologist Dr. Sean Gunning. Thank you so much for being with us, you two. Dr. Gunning, I want to start with you. Explain why skin cancer is A, avoidable, and B, we're told, highly treatable.
Thank you for having me. The facts about skin cancer is that any person of any color can get skin cancer, and about 1 in 5 individuals will get skin cancer at some point within their lifetimes. Skin cancer tends to be very related to the amount of sun exposure that you received in your lifetime. So by taking precautions about the sun, we can minimize the risk to your skin of developing the skin cancer. And also about skin cancer is it's one of the cancers that if you detect very early, that you can actually cure quite easily. So that is a very important part.
And what's the best advice for protecting our skin health and staying safe in the sun this summer?
Well, we really want to avoid sunburns and cumulative sun exposure. And the best way to do that is through a combination of use of protective clothing as well as sunscreen. Sunscreen has 2 different types of protective factors. One is the SPF, which protects for UVB, ultraviolet B type radiation. And we can think of UVB as the type of radiation that predominantly causes skin cancer. The second type of radiation is called ultraviolet type A. And I like to say the A is for aging. So that type of wavelength of sun tends to cause photoaging, wrinkling of the skin, and it has a smaller but real contribution to skin cancer. When we choose our sunscreen, we would like to choose a sunscreen that has an SPF factor of 30 or above, and one that's broad spectrum, which contains protection of both of those wavelengths, and also has water resistance, which allows it to be stay on the body better when you're exposed to water or sweat.
And Dr. Schlesinger, what treatments are available for skin cancer, and how effective are they nowadays?
Those are great questions. There are several different ways that we can treat skin cancer. First and foremost, our dermatology and surgical colleagues use surgery to resect the lesions. But there's other treatments as well. There's a treatment called intralesional therapy, where medicine is actually injected into the skin. There are also other treatments that we can take by mouth, so oral medications. Also, immunotherapy has really been a huge benefit to folks with skin cancer. Chemotherapy is also used, and occasionally radiation for advanced cases.
And what's the best way to educate our children about the dangers of skin cancer?
The best way to educate our children is to lead by example. It's important that we teach them, but also show them how to wear sunscreen, cover with hats, keep exposed parts of our body covered during the peak hours of 10 and 2, and also just be aware and sensitive to the damage that can happen from the sun. So again, leading by example is very important.
Dr. Schlesinger and Dr. Gunning, thank you so much for being with us with that important information. And we want to remind our viewers that you can download your free Healthy Living for Cancer Prevention and Wellness Guide and find more information about skin cancer self-exams at umstjoseph.org/WMAR. We'll be right back with more Midday Maryland right after this. Stay tuned.